Okay, I want to make sure that everybody understands the narrative case report and how to write it, and give you a few examples so that you're able to write it for Anthony. This is the same type of case report you will be completing for your culminating case assignment at the end of the course. So it's important that you understand what goes in each section and how to write it so I can give you good feedback that you can then carry into your culminating case. So the first section is background information. You're just going to put the information as you see it in the case for Anthony. If you don't know specific items, you can make them up. For example, the date of the report, you can do today's date, the date that it's due a month ago. It doesn't really make a difference to me. His date of birth, just calculate 10 years back from whenever you're filling it out. So he's 10 years old. You can make up a last name if you'd like to. His primary diagnosis should be related to what he was referred to, so his medical diagnoses, what he's being treated for, and he's being treated for developmental delay. So in ICD-10, you need to go to the ICD-10 lookup website and find a diagnosis related to developmental delay. There is not one specific diagnosis that's just called developmental delay. There used to be, but now it has been broken down into multiple different names. You can choose anything that you think is appropriate. So it could be related to a coordination disorder or related to a learning disability, whatever you think is appropriate, as long as you have a primary diagnosis that fits generally with Anthony and an ICD-10 code that matches that diagnosis name. And you need to put both the name and the diagnosis code, and it would show up something like developmental delay, parentheses, code, whatever it is. And that would be it. Now, that's not the code or the correct diagnosis name listed in ICD-10. I'm just making it up, but that's the format for it, the name and in the parentheses, the code. The therapy diagnosis is whatever you're actually treating. So in a case like you just had with Linda, you're not treating her broken arm. We are not able to fix the fracture itself. We're treating so her primary diagnosis would be related to the fracture. Her therapy diagnosis would be related to what you're actually treating her for. So the generalized weakness or pain or limited mobility. So what are we working on? In the therapy diagnosis in this case, it can be the same as the primary diagnosis. So if your primary diagnosis is related to coordination disorder and therapy is actually going to be working on that coordination disorder and fixing the coordination problem, that can be your therapy diagnosis as well. So in Anthony's case, they're probably going to be the same name and number. In other cases, typically orthopedic cases or neurological cases, they are going to be different numbers. Another example would be somebody who's had a CVA. We aren't actually treating the CVA. We are treating the performance concerns resulting from the CVA. So the visual perceptual concerns or the weakness concerns or the aphasia. And we're going to be treating what's the result of the CVA. Precautions and contraindications, if you don't feel there are any, you can put an NA. If you do think that there is some kind of precaution or contraindication, you can write those down. And evaluating therapist is just your name. Reason for referral, I put in here, it should only be 1 to 2 sentences. Who referred them and why? Make sure that you are reading the examples, that you are following the directions, and you're also referring to this grading rubric to help you decide what you need to write in each section. So reason for referral, make sure you put in there who referred the client, the physician, the teacher, the parent, who was the referral, not their name, just their relationship to the client, basically. And the primary or specific reason for the referral. for issues with handwriting, for issues with performing at grade level, and the functional component. So it should read something along the lines of client was referred to occupational therapy services by the physician, that's who referred them, for decline in ADL participation, that's why they were referred, specifically muscle weakness and balance concerns. So for Anthony, it may be something like client was referred for occupational therapy services by teacher for concerns about participating at grade level, handwriting, and coordination. Okay. Occupational profile. You want to make sure that you are including, and this is bolded and capitalized for a reason, relevant occupational history. It has to be related to the concerns. The fact that he has a dog probably has nothing to do with his occupational history related to problems at school. Okay, so it needs to be relevant occupational history. Anything about what they do every day. He's in 4th grade. He rides the school bus. Do not just copy and paste or rewrite what is in the case report. Summarize it. It should only be a couple sentences. What's very important. Any strengths or concerns relating to the occupational performance, so the parents are very involved, or has a certain piece of adaptive equipment. And the priorities of the client. What are their goals, or what are the parents' goals? In the analysis of occupational performance, you're going to have first the assessments. You want to include the full name of the assessment. So for Anthony, we have like the school function assessment. You need to write school function assessment and then in parentheses the abbreviation SFA. From then on, you should just refer to it as the SFA. Don't keep repeating school function assessment, school function assessment. For something like the bot, that's going to get really old to write out the entire name. You should include a very brief description, very brief, 1 sentence, maybe 2. Why was this assessment chosen for this child? What specific client factors or performance skills or occupational concerns is being assessed with this test? So the school function assessment, parentheses SFA, is used to measure a client's ability to participate in school-related tasks. Okay, that's why we chose it for Anthony. You're going to list for each test that you complete, and then the findings section, you should report the results and interpret each of the assessments. So you should have the SFA. And it should say SFA, and then you should have a chart with the SFA results in it, and right below that, a little paragraph describing the interpretation of those results. Now, I have provided you with the tables for all of the pediatric assessments done for Anthony, so you don't have to spend your time creating tables and transferring numbers. In the final culminating case, you're going to have to make up your own tables, but to save you time, I've provided the tables in a Word document with the rest of the assessments results. So you should be able to just copy and paste those tables into your findings section and then write your interpretation for those. It should not be a repetition of the data. Your interpretation should not be repeating the data in any way. Don't tell me that he scored a 98 in classroom participation with a cutoff score of 100. I can read that in the chart. This is the place for you to show me you know what that means. That you can take those numbers and all that information and you can concisely tell me, like you did in your verbal reports, that the client is having problems in this area, which may be caused by this. This client is at risk for not moving on in school They had the most difficulty with XYZ. Pick 2 or 3 really important points. Specifically, they had problems with this, this, and this. So if you're looking at the bot, maybe, say the client is having difficulty with upper limb coordination. They had the most difficulty with throwing and catching a ball. This may make it difficult for the client to participate in recess or physical education activities. Okay, that would be one part of the interpretation for Anthony. Then I may pull something else out of the bot and say they are having difficulty with fine motor precision tasks. Specifically, he has difficulty with handwriting or with replicating objects, drawing geometric shapes. This may make it difficult for him to write legibly. Okay. So I'm taking the data, I'm saying here is the general area he's having difficulty with. Here is 1 or 2 specific things within that area that I can point to as saying these are really tough for him. And this is how that relates to a performance skill, a client factor, an occupation that he needs to do. Okay. You're going to do that for each test. For summary of findings, this is where you're going to collect all of the information you just wrote in the interpretations, and you're going to pull it together to create a picture. So you should be able to make connections between 2 or 3 assessments and say that the bot demonstrated that his results on the bot and his results on the etch indicated that he has issues with fine motor precision, which may make handwriting difficult. This may be due to a strength problem, a coordination problem, a visual perception problem, whatever you think it is in relation to. So this is your time for you to say, based on the above interpretations, I see a connection between the results of this test and this test. Specifically, it's pointing to why he's having problems in this occupational area. I think that those problems may be due to whatever performance skill or client factor, performance pattern, or whatever reason you think he might be having those problems. Try and use language from the OTPF to guide your reasoning. Okay. If you think about it, when you're talking about the summary of findings, you're saying that here is indications that he's having problems with this specific occupation. This is why I think those are a problem. You're going to take that why you think it's a problem, and that's going to be in your recommendations of what you're going to be working on. Those are the goals you're going to work towards. You're going to improve his handwriting within 1 month. You're going to do that by helping him build his strength or helping him build his coordination or his in-hand manipulation, whatever it might be that you think is contributing to the handwriting problem. Okay. This is really your time to shine. This is your time to show that you are an OT, and this is what makes you an OT. This is the part of the evaluation, the interpretation and the summary of findings that cannot be done by an OT assistant. This is where you're using your clinical reasoning, and this is the section that I'm really going to be paying attention to. Can you bring it all together? Okay. The recommendation section we already worked on in the verbal report, and this is where you are telling us, do you recommend services or not? How long, how many times per week, how long per session are you going to be recommending those services for, and what's the focus? You should also determine if there needs to be a referral to another profession. for the purposes of this class, you should recommend to another profession. You need to recommend another service. It's not an option for the purposes of this class. We are not the be-all, end-all of healthcare, and we need to recognize that other healthcare team members can bring something to to our plan. So I don't care who you recommend services to, but you need to recommend them to another healthcare profession. Remember, you are just recommending a referral for an evaluation by another profession, not the length of treatment or the duration. That's outside of your ability. So don't say that the client will be referred to PT for treatment of gait abnormalities 3 times a week for 3 weeks for 60-minute sessions. You can't make that determination, but you can say that you're recommending the client to be referred to PT for concerns with gait. And goals, again, we're going to be using the COAST goals. You need to include at least one intervention goal. Using the COAST method, it should relate to your summary of findings. If you didn't write in your summary of findings that you think coordination is an issue for Anthony, there should be nothing related to coordination in the goals. If you didn't discuss handwriting as an issue, don't write a handwriting goal. Okay. And then your signature. Okay. That is the evaluation report in narrative format. Make sure again that you refer back to your grading criteria so that you can see exactly what we're looking for. Make sure that you are doing things like being concise, discussing your reasons leading to the recommendation. So if you are going to be recommending services, don't explain away all of the problems that you're addressing in summary of findings by saying things like, but the client was really tired. Yeah, they have problems with handwriting, but I really think that they need glasses. Okay, you're explaining away the reasons, and then in recommendations of findings, you say, but they need OT. But you just told me in summary of findings all the reasons that they don't need OT. And then make sure that you continue to look at it. Also, don't forget that there's this other part down below. You should be following the template. Just take the template we provided, take out the blue areas where we wrote. So take out these blue areas and just type in your responses. Okay? Follow the template. It makes it easier for everybody. It should be organized. Don't jump all over the place. Make sure it's easy to follow. If you're talking in circles, it's going to make it difficult for us to follow what you're reading, and we're going to be reading this like we were a reviewer of documentation. If you're talking about an insurance person reviewing your documentation and they start reading it and they can't follow what you're saying, they're just going to deny. They're just going to deny it, or they're going to flag you to be audited. Okay, which nobody wants. So you need to start working on it being clear and easy to follow. Please pay attention to your sentence structure, punctuation, spelling, and grammar. It really makes a difference in documentation. You can get denied for having so many errors because it makes it too difficult for somebody to read. And it's unprofessional. Be very cautious about it. It makes it difficult for us to read as well. And it changes the meaning of your sentences sometimes. Use appropriate professional terminology. There should be no I in your report. You should never say, I think. It should be written in third-person language, and make sure that it demonstrates that you have proofread. Okay, so that's everything for the narrative submission for Anthony. Let me know if you have any questions.